I am going to talk about this. Spending time, I know the database was discussed last week in the database conference, and I'm not going to spend as much time on the database specifically as I am talking about the partnership that came about to create this database. A number of years ago, there was discussions with groups of folks in terms of really being interested in nutrition and how nutrition plays a role in promoting health and preventing disease. And leading these discussions was Dr. Kathy Witecki, who was our former Undersecretary and Chief Scientist, along with Dr. John Milner, who at that time was at the National Institutes of Health, leading a nutrition group at the National Cancer Institute. And they got together and they were talking about the fact that we really need to know what people are eating in order to be able to assess what role the diet is playing in the health of the population. And in our country, so many people are eating foods that are created by manufacturers and other folks that we really needed to have access to what it was they were eating. So there was a discussion about the fact that we really needed to get together and have some way of having access to what the manufacturers were putting in their products, so we had a better idea of what folks were eating. At about the same time, our administration in the US was actually pushing the public-private partnership thought and theory, so it really made sense to really come together and develop several public-private partnerships. And the first one that really made sense to take off was the one that looked at getting information on the branded foods. Anyway, so I'm going to talk about that partnership, and the partnership evolved, and there was a tremendous amount of work that was put into it. But today we have the partnership for the branded foods database of the USDA, and those partners consist of the USDA, certainly the Nutrient Data Lab from USDA that actually puts together, and the branded foods product database is part of that nutrient database. We also have the input of ILSI. ILSI was very much involved with the beginnings of this. ILSI took on the role of convening many of the groups that we needed to bring together to talk about what needed to be done. They convened the criteria group, and that was made up of folks from government who are involved with research, regulatory, policymakers, health professionals, and academia, industry, nonprofits, federations, associations, scientific areas. They brought together groups of these people all together to tell us what it was that we really needed to have in such a database. They also convened groups that were involved with the IT structuring and telling us what we needed to do there in terms of having this appropriate. So ILSI was one of the first partners that was on board right away. We then have brought in additional partners, GS1 US, and we have a representative of that in the audience, and if there are any questions about GS1, I'm sure Angela can answer those for us. And they also have, we have data providers that go through the GS1 company, and that's One World Sync, as well as Label Insight. And we have a sixth partner who's been with us pretty much the whole time, but has just formally become one of our partners, and that's the University of Maryland at the GIFSAN Center. And they are also involved with helping us with some quality control items, and I'll go into some of this a little bit later in the talk. So the partnership is for public health, the Branded Foods Database, and the goal is really to enhance public health and to share open data by augmenting the USDA National Nutrient Database with nutrient composition and ingredient information from branded foods. So we have one place to go to where you can find out all of that information to be able to use for various different things. The public data is available to anyone. You can go to the database, you can find it, you can use it. We found that it's used by federal agencies, so regulators as well as policymakers, scientists, the research community. We're linking it and trying to get access and work with some of the international databases, and we've had actually some really terrific conversations already this week in moving forward in that direction. Proprietary databases using end users. We've got a lot of interest from app developers that really like to be able to use the database, and certainly with the food industry as well. So, if you're going to put your items into the nutrient data, into the branded foods database, what is it that you have to have? So there are certain criteria that the criteria group that was convened said that really have to be on this, and one of which is the parent company private label. That information has to be supplied by the manufacturer. The nutrition facts panel has to be on there, and the expanded facts panel. The product name and the generic descriptor, certain weights and measurements, the serving size in grams or milliliters, the rack serving size. The nutrients shown on the nutrition facts labels are in 100-gram basis or 100 milliliters on our database. And a date stamp, and this is really critical because a date stamp has to be associated with when that product went onto the database, because there are so many reformulations and changes in products that you really need to know exactly what product you were looking at when you were assessing it, or when you were doing your research, or when you were looking back over trying to look at what was in the product. So the date stamps are really critical for being there. We also include the ingredient list and the sub-list. A little bit hard for you to see over there, but it's a little bit easier to see it in the database, so you'll be able to use it there. And again, the G10 number, which is a unique number that is identified with that particular item, so that you can search through the G10 number and knowing you're going to go to the very precise item that you're looking for. We have, in the past couple of months, received questions about what's happening with the new FDA label, and whatever's going to be required on the new FDA label will also be required to be put into the database. So we're going to update as soon as that's put into effect. We're already getting that information from many manufacturers. They're already jumping ahead knowing it's going to be required, so they're already supplying that information. So that was the data that has to get into the database. So the next obvious question is, how does the data get into the database? And as I said, we work with several partners in terms of getting data in there. The first partner is GS1. And GS1 is a user-driven, not-for-profit global standards organization for product identification. As it's the most widely used global supply chain standards, GS1 has offices in more than 110 countries around the world. The GS1 standards are the global language of business. It's a language for identifying, capturing, and sharing of information automatically. And it's accurate, extremely accurate, so that anyone who wants that information can understand it no matter who they are or where they are. They can get it through the GS1. So GS1 is our partner, our specific partner that we have an agreement with, and then they have subcontracts out for the data flow folks. The data flow folks are Label Insight and One World Sync. And One World Sync is a GS1 certified data provider, and it's the leading provider of product content solutions, enabling more than 25,000 global companies in over 60 countries to be able to share authentic, trusted content with their consumers, their customers, and so allowing people to make the right purchases and knowing exactly what it is what they're purchasing to promote wellness and good life and health style decisions for the consumers. Manufacturers were able to leverage their One World Sync data feed to publish to the U.S. branded foods products database. And this is one thing that's really critical, is the manufacturers don't have to go out of their way to do anything different. They're already going through this system. So we're not asking them to do anything, create more work for them. So it worked out extremely well to be able to partner with this group. Not every manufacturer goes through this particular system, so we had a secondary source of where we get our data, and that's from Label Insight. And Label Insight is an industry leader in product transparency through data science. It uses a very easy drag and drop interface so that brands, the labels, the entire package label can be visualized and drag and drop right into the database as is. So it's very, very accurate. And it can be done in a very simplistic way so that any manufacturer can participate with them as well. So those are our two data providers at the moment that work with it through GS1 to put all of the data into our database. This is the website for the nutrient database at the National Ag Library, which is housed for USDA.gov, nutrient database, and that's the opening page that you'll find when you go there. And we have some representatives in the audience today. Dr. David Hedowitz is here, so he can answer any very technical, precise questions about the database. The database, the branded foods database was new, and it was something that was brought into our nutrient database. And last year, it was launched by the Secretary of Agriculture, at that time was Tom Vilsack. He launched it at the GODAN meeting, which is the Global Open Data for Agriculture and Nutrition Conference. That we launched it last year. At that time, prior to the launch, there were about 8,500 items in the nutrient database, which was a significant amount of information on some of our nutrition and items. At the time that we launched this, we were able to expand it to 80,000 items. So last September, when we launched this, it went to 80,000 items with the branded food products database. So to give you an idea of who's using the branded food products, we've gotten a lot of questions and input, and we got contacted quite a bit, and so did the partners as well. And so it has provided dietary guidance to dietitians, to scientific researchers, to policymakers, to general public. It's tremendous the access that people have to this and the number of people that have gone into the database to use this. Just a little bit more about the database. As I said, it's part of the nutrient database from the ARS laboratory, and it is actually housed in the National Agricultural Library, which is in Beltsville. You're able to go in and search it when you go in, and as you would search the nutrient database, you can now search seamlessly. You won't even notice that there's any difference in there for the branded foods database. It's very accessible, it's public, we're a federal agency, so that is part of our role, is that we have to be able to give back to the public and enhance their ability. So anyone in the public that needs the nutrient database, needs the nutrient information, can get there. So in terms of the food composition database, the research community felt that this was really a huge benefit by gaining a much larger amount of data from the manufacturers directly, so they would be able to have it. It's not as accurate as the nutrient database, the information that's been in the nutrient database before that's been done by analytics. It is a tremendous paradigm shift, and it was not something that ARS was extremely comfortable doing, because we really like to be able to have data that's very accurate and analyzed. But we had to go to a point where we had to depend on the manufacturers to give us the accurate and correct data. Right now, the database has 215,000 items in it, so you can imagine, after seeing Morgan's estimate of what it costs to analyze a product at almost $100,000, we are not going to be able to analyze 215,000 items. So we are depending specifically on the manufacturers to give us the information. We do have a quality control process that it goes through, so that when we look at the columns of where the items come in, if something is clearly way out of whack, then we go back to the manufacturers and say there's something the matter with this particular number. There's no way you can have that much vitamin A or that much protein or something. But in terms of analysis, we don't do analytics on other products that come in. So what we're hoping is that the data that's coming in is very close to being perfect and being very exact. But for the research community, what this meant is that they are going to be able to have a much larger access to dietary intake and exposure assessments. And so we think this slight trade-off that we have in there is probably a benefit, because there's so much more information that can be gained by having this branded food database. It's going to allow us to be able to tease out dietary patterns. And the one thing that you can do, which is really interesting in this database of the 215,000 items, is you can actually go in and search by ingredient. So if there's something that you as a dietitian are prescribing for your clients, or there's some research that you want to look at where you want to see if there's an association between certain health outcomes and certain products, you can actually go in there and search by ingredient. How do you do this? Well, you go to the database, as it was on the previous slide, but then you go to the advanced setting of the database, and you can put in there all kinds of information. You can search by manufacturer, you can search by food type, you can search by ingredient, you can search by the type of food that it is. And I would suggest that not only do you do that, but you put some of the, you whittle down your search of it, because some of these items, if you can imagine, there are that many in there, you're going to get a huge response from this. So if you just put chicken in there, you're going to get a huge response for that. So you may want to identify some things that are very precise that you want to look at. But the data's all there. So if you're giving information, if you're a dietitian, you want to give information to people on how to reduce maybe sodium in their diet, if they need to do that, you can go to and look at which soups. If they want to know what type of soup, you can go and put sodium in there, and you can actually look at comparisons of them, so you can give the best information out for your clients, and as well as if you're a policymaker, you can look across there. And if you're scientific, if you're researchers, you can understand what's in the food and how it may be related to specific outcomes. Okay, so just going quickly over some of the numbers. As I said, I'm not going to delve into the database. It's there, it's online, it's for you to go and play with. But I just want to give you some interesting numbers that we've been able to ascertain in the last month or so. So it's about 215,000 items. It continues to grow. We're going to have weekly updates. So each week you go to it, you're going to see more and more things. And not only that, but you may not see more items, but you may see new reformulations. So it's not just new items, but it's also reformulations of the things that are currently in there. Since it was launched last September at the GoDaddy meeting in New York City, there's been 17 million page views from about 102 million viewers. So it's getting out there, it's viewed, people are going to this. Of those views, so the people that have come to the database, there are return users, so obviously there's a value. People don't come and go one time and then never go back. So we have 54% of those viewing the pages are return users. So we expect that to continue, because there's always something to go back and look at. So it's a value to people, they're going to it, and not only are they going to it, but they're going back to it. Where are they coming from? So we've been analyzing the access to the database. The majority, 50% of those going to the database are from the US. It's widely known in the US, so it's not a surprise that there are that many folks coming in there. But you can see that there are a number of other countries that are using the database as well. So we're adding value across the globe as well. In terms of the questions and the comments that come in, and I have to say that I'm a federal employee and I'm very easy to access. But we do provide a website and an email address if you have questions and comments, so you don't have to send them to me. If you send them to the website that it's provided in a few slides, you'll probably get a quicker response, and one that's very focused and right on to where you need to get that information. But in terms of the questions and comments that have come in, we looked over our various stakeholders to see what it is that they were asking about, or what it is that they wanted, and maybe they haven't seen so far. So it's really interesting, the food industry and the app developers, they want to know when it's downloadable. Right now it's not downloadable, but we hope to have it there by the summer. We're working on some communications and interface situations that we have to fix in order to make it downloadable. They want the APIs, they want to be able to get that. They're interested in the analytical methods. They want to know what's been analyzed and how it's been analyzed. And they want to know when's the next data update. For the first year, initially it was a couple months, then it got it quicker and quicker, and now we're at the point where we're at once a week. So the updates will be there very, very quickly. In terms of our educator stakeholders, they want to know if they can use it, and they have actually used it and sent us comments about it in some of their curriculum development, and they're using it as a tool to teach food label. Our consumers, the comments that we're getting they sometimes need a little bit of support in navigating the database, so we're trying to figure out ways to make it easier for the average consumer to be able to get the information that they need. They're talking about missing nutrients. Each person out there has his or her favorite nutrient of choice that they'd like to see specifically on there. We will be expanding these hopefully, but we don't have everything there yet. So that's one of the big questions is where's this nutrient? The nutrients in foods, they're very, very interested in all of the different nutrients in food. So it's really great to see the consumers going to this database. And then in terms of probably our critical area is the researchers. They're going to be able to look at the nutrient content of foods over time and be able to look at trends and be able to look at relationships between these nutrients and these foods and food patterning over time, which is going to be really, really helpful for us identifying how to make better choices for health. And they want to know things about nutrient retention. So we haven't been able to answer those questions yet on that. But these are really important questions that we're getting because it will help us refine and update the database as we go forward. The two main questions that we're getting are when will the database be downloadable? Because right now it's fully searchable and you can go on it, but it would be so much easier for you, and we realize that, if you could download it and then search it and go and do what you need to do by that. And we are working on it, believe me. And then how often is the database updated? So we've been able to now move it to a weekly update. So new products, reformulations, and things are going to be in there on a weekly basis. That email address down there, that is the place to send questions and comments. You will get a very quick response. It'll go directly to the person, whether it's a technical issue, whether it's a type of scientific, whether it's a general question. That website right there, that email address, you will be able to get a much better response than if you send it to me. So write that email address down. This we thought was rather interesting. So where are people, what are people using to get to the database? And so 72% of the people coming to the database are using a desktop, which you would imagine. That makes sense. But if you look at the rest, 21 and 6% respectively are coming through from mobile devices and from tablets. So people are out there using them wherever they are. They could be standing in the grocery store looking at things. They could be riding home. They could be on transportation. So it's really interesting. It's not just the folks sitting at their desks wanting this information. It's really it's going to the whole community. Where are they? What's going to the database? So in terms of where the information is flowing through, the significant portion of it, 45%, is coming from search engines. People are 33% are going directly. There are enough people that know about the database now that they go directly through to the database. There's referrals from other websites. Social media is there, slightly there by email, and a couple of things that don't fall into those categories from the other. So people are coming to this database. The response from manufacturers has been overwhelming in a terrific way. They are very, very interested in participating in this and sending their data through. Both of those options that we give to them are very well trusted. The manufacturers are aware of them now and feel very comfortable having their data sent through. One thing to mention is we at ARS are a scientific agency. We don't have any role in regulation, and we don't have any role in policy. So we just gather the data and make it available. That's something that was very appealing to manufacturers. They were not as comfortable working with some of the regulatory agencies. So we've had a very good response from folks because we're interested in the science and the data and providing it to anyone who needs it for whatever their particular use is. these options that we have, they operate at the current business best practices. So we looked around, we studied what would be the best way for manufacturers to get their things in, and we chose the ones that would be the easiest and most efficient for the manufacturers to use. And something that was unintended, but it was a great benefit, was the discovery of accuracy. I mean, people say, oh, well, the industry puts their information and it's probably not very accurate. Actually, it is. It's very accurate, and they're required to be accurate. So it was very, very positive to find that much of the data that's coming in is extremely accurate to what's in the products. We rely on them to make sure it's accurate. So what we have done with our industry partners is to say, you go to the database and see what's on there and make sure that it is accurate to what you think that you're submitting. And if it's not, we have a feedback loop and we work with them to make sure that we get the accurate amount in there. They like their products in there. They like it available to the consumers, and they want it to be as precise and accurate as it can be for them. And you know, I throw up the gold standard. USDA database is not perfect. It doesn't have, you know, it's not everything, but it's looked to by many industry, by many cultures, by many research, by folks around the world as being a pretty good source of information. So it seemed to be the right place to have for the branded foods database. So it's something where it's trusted, it's recognized. Although it may not be absolutely perfect, it satisfies folks to be where they're feeling very, very comfortable about putting their data in, and those people that go to the database are very comfortable about knowing that the data is accurate and very, very useful. So it's worked out both extremely well for us, for the feds, but it's also worked out really well for the industry. So just a little brief couple lessons possibly learned. So we're 6 partners that came together, and when I went through the spiel, it sounded like it was probably just very simple and very easy, and we all decided we were going to do this. It took a couple of years to get this done. And the one thing, we have a weekly phone call with the 6 partners. And almost every single week, everybody makes that call. They are extremely dedicated to this process. They're very interested, very dedicated. Can you imagine for 2 years having a weekly call that pretty much everybody attends? I mean, it just shows you the dedication of all the partners into this. And I have to say that we don't have a formal signed partnership agreement that forces everyone to have to work on this. They do it because it's been extremely beneficial for everyone. The other thing is, there's no way that we as ARS could have done this on our own, or industry could have done it on their own, or GS1 could have done it. So it's something that really required all of the partners to work together. And that's really critical. And when putting together a partnership, it's one of the first ones that we have really successfully done, and everybody in that partnership has got to get something out of it. So it's not just that everybody has to put things into it, but they also have to get something out of it, and we've been able to maintain that for over 2 years now. The expertise in the data quality and management, the data collection, supply chain standards, and research knowledge was essential, and we really got that through our partners, especially through GS1. This is one of our first real successful partnerships. We have 4 others on the list that we're going to be starting to do as well. But this one, we feel, has really provided us a lot of lessons learned, and we're happy to share those with you, because we certainly know some pitfalls that you really don't want to go through. We're happy to tell you about those. It was a really good learning experience to do this. We think this has global applicability. We have an interest to leverage this model in other regions or countries, or help other countries if they want to develop the same type of model, helping them understand how to get through it, how to make this type of public-private partnership. We can link with them. We're very interested in interacting. So whichever fits the community the best, we're willing to work forward and collaborate with. So we also are very interested in this because even though this was set up for the US and the US population, we don't only eat food that comes from the US. So we're very interested in global food and the global food supply as well. And again, as I said, the partnership is very willing to share all of its lessons learned. We're very happy to help you get over or not fall through some of the pitfalls that we experienced. So for the next steps of this database and the partnership, we're going to continue to grow. As you see, in a year, it's gone from about 80,000 to 215,000 items. And it's going to grow a lot faster because we've gotten over some of the stumbling blocks and kinks and things that we needed to fix as we were doing this as a test for the first year. So we want to actually move the data beyond just the Nutrient Data Lab to the database, or FNDDS, the Food Nutrition Database and Dietary Studies, as most of you are probably aware, so that we can get that data into that system as well. We're going to increase the private label food items. We have some in the database now, but we are now negotiating with many of the retailers to get their private label stuff in there. We're going to add restaurant data, foods. So we're going to have not every restaurant, but certainly the bigger ones in the chain restaurants are going to be available in there. And we are going to align on a standardization, validated algorithm that will be used across all food products to determine food groupings, which is a big request and a big interest for the researchers. And that's my last slide. I will take questions. Again, this is the database place to go for questions and comments. I love the public, but I can't get back to everybody, so this is the way to do it. Thank you.